It's like the pandemic has shaken the confidence of people in trusting too much in medicine, hospitals, doctors. Now that has completely failed. Now, do you think that people, at least now, will think that nurturing health by good practices is an essential component and that cannot be traded with or bargained with?
Certainly, in this COVID, people have lost faith in medicines. That is one factor I have seen. What was lacking is the institutions like CCRYN. They have not come forward with, you see, aggressive programs to try COVID patients through naturopathy. I personally believe that if you keep COVID patients on nature cure treatment with juice fasting and all that, with the colon cleansing and all that, they can easily be treated. The death rate would have been very, very low. This we should have tried with the due permission of the government. That we could not do. Otherwise, naturopathy would have been at a different stage now. I came to know that in Chennai, our joint director, what is his name? I'm forgetting. He has
Dr.
tried with
Manowalan.
some, Dr. Manavalan. He has done a good job. I came to know that he has tried with some patients, and government of Tamil Nadu is encouraging them. They have appreciated the work done. So, like that, we should have done in whole country, and we should have come up with some specific research programs, and we could have demonstrated a lot of things of the efficacy of naturopathy. Anyway, naturopathy depend upon the principle of vitality. So long as you have enough vitality, you can fight any disease. And I stand with that. And I propagate it even today. And many of my patients who have suffered from COVID and all that during these 2 years, they have tried the naturopathic methods at home, and they are all very fine. And they are very grateful to naturopathy. Through naturopathy, I became all right, and their health has improved, and with no other side effects. People who have suffered COVID, after coming from hospital, they are having different issues. Some are having heart problems. Some are having neurological problems. All these problems were not there with the people who have done naturopathy during their COVID period. So people have started realizing the importance of vitality within the body, healing power within the body. All these beliefs are gaining momentum today. And I hope in the years to come, naturopathy will have a different place in the society and better place.
Yes. Sir, you are known for your ability to read books and then very systematically analyze those books and then share it with people who come in contact with you. So from that, I want you to suggest youngsters and all of us what are the books that are absolutely not to be missed by any naturopath.
Actually, history of naturopathy is required to be rewritten, and that I am trying, but due to my, you see, occupation with universities and all that, I could not do it. But I think every naturopath should read at least Dr. Lindlar's books. He is one of the most prominent authors of naturopathy, and his books are really good. And his this theory and practice of naturopathy is a wonderful book. It should be read. And before I go ahead, I will just tell you that after my retirement in 2008, I made a study about the status and role of Ayush in local health traditions. So that was a survey we conducted under the National Rural Health Mission, and I studied 24 states of the country. In those days, it was said that only 2-3% people believe in Ayush systems, Indian systems. And after my survey, it came out that more than 90% of the people in the country, they believe in Indian systems of medicine. They want to undergo Indian system of treatments, but they don't have facilities. Otherwise, they would have preferred to go to Indian systems rather than to allopathy. That was the finding. And this survey report was published by NHSRC. It is here, it is a voluminous book. I'll send you one copy.
Yes, sir.
And this was done in year 2009. Now it is more than 10 years. I want to study once again, but it is a very difficult thing. In this study, we were given only 36 lakhs rupees, and I had to spend more than 50 lakhs. Most of the money from my own pocket and from the university funds. So people were very angry. So I fear conducting this survey again. And HSRC funded me about 36 lakhs rupees. But now if we study this again, it will cost around 2 crore rupees. So if NIN or CCRYN or MDNIY or some such organizations can take up this work, it will be better. We need to study the status of naturopathy and other Ayush systems in the country, both in urban as well as in rural settings. So some good things will come up.
Can you also share some of your experiences of dealing with acute conditions through naturopathy?
In dealing with acute cases, the most difficult part is as soon as some acute condition set in, people used to run to the hospital or to the allopathy doctor. That is the greatest problem. They will come to naturopath only when they get no result from allopathy hospital or doctors. Most of our old patients, they used to come to us in acute conditions. And as soon as they come, we used to put on some sort of juice fasting or fruit fasting or on soup therapy like that, colon cleansing. And I think within 24 to 48 hours, people used to get relief. And in 3 days, in most of the acute conditions, we used to demonstrate a very good result. So old patients, they believe us and they used to come. New patients, they hardly come. If somebody is suffering from anything acute, they will first thing they will do is they will run to the allopathy hospital for some sort of a medicine. So that is the difficulty. But if we educate people, I think they will start taking naturopathy in acute cases. Old people, old you see patients, they will never go to hospital in acute conditions because they know that their body is reacting, their body is eliminating something, they are having something wrong in their body which is to be get rid of.
Yeah.
So new patients, it is very difficult. But for old people, they used to come. We have no problem at all.
Sir, how do you feel now? There are more than 50 naturopathy colleges in the country. and many states, they are really showing lot of interest by incorporating nature cure and yoga in government setup. Say for example, Tamil Nadu, recently they have come up even with three exclusive COVID care centers for naturopathy and yoga. So this kind of recognition system is getting. So how do you feel?
Nay, it is very good. I'm especially grateful to Dr. Manavalan for doing such a nice job in Tamil Nadu.
Yeah.
And in COVID period, he has done a lot of work. And if we propagate properly, I think other state governments will also follow suit. When I came to naturopathy, there was no college at all. And then Calcutta College came up that was not affiliated to any university. And thereafter, this Gandhi Nature Cure College came up. It was affiliated to Osmania University. So it was the only college which was affiliated to a university. And subsequently, health universities came up, and in Karnataka, SDM College and Jindal's College, and all these colleges come up. And today you are saying 52 colleges. It is very heartening to know. It is very encouraging for newcomers.
Yes.
Now, the only thing that is needed is in these colleges, the students are required to be taught nature pure philosophy and grounded them practically very well. The way Dr. Bankat Rao used to do in Gandhi Nature Pure College. In all the old products of Gandhi Nature Cure College, if you see their way of dealing with the patients is still quite different from those from students dealing with patients from other colleges. The reason is that Dr. Bankat Rao and thereafter me and thereafter all the people who have come up in Gandhi Nature Cure College, they used to ground the students in philosophy as well as in practicals very well. I
Yes.
was having a hospital here in Delhi. I was director of that, and I interviewed some students for appointing as naturopath. I find in some of the colleges, I think the practical is not done well. Most of the students they don't know how to you see administer the therapies properly, and some of them were not grounded in philosophy well. But anyway, now 52 colleges have come up. Visiting professors should be appointed by these colleges and universities so that old people like Dr. Lakshmi Narayana is there from uh, Calcutta College, he is in Vizag. Dr. Lakshmi Narayana. Dr.
Yes.
Srivastava is there in Lucknow, he is from old Calcutta College. Dr. B.N. Singh is there from Dr. Calcutta College, they are there. Old students of this Gandhi Naturopathy College, they should be called as visiting professors or lecturers, and the students should be grounded well in philosophy and practice. All of them should know how to deliver the therapies to the patient. What is happening is that nowadays acupuncture is added as a subject in naturopathy. Most of the newcomers they practice only acupuncture, not other therapies. They are naturopath, BNYS, and what they do in their clinics, they practice acupuncture. I have no objection with acupuncture. I am the advisor of the Acupuncture Association, National ASA, and I do believe in acupuncture also. In my childhood, I have seen so many things with Chinese people. Today, they are, you see, performing even major surgeries with acupuncture. So I have no opposition to acupuncture, but naturopaths only practicing acupuncture, that I could not assimilate. That's why I wrote an article and sent to you. I don't know whether it was published or not some time back, some 2 years back. And the heading was ki, what should be the principles to integrate new therapies into naturopathy. It was an important article. I sent for publication in your Nisargwani Varta. But thereafter, I could not find time to trace out whether it was published or not. The idea was only for that. We have added acupuncture in naturopathy with good faith that our people will become more useful. But what is happening? Our people have started practicing only acupuncture and left all hydrotherapy, mud therapy, and all that. And they stopped talking about uh, toxins and you see lifestyle intervention and all these things. So we should be very careful.
Yes.
Secondly, most of our doctors they are going for spas and they are spa manager and all that. So their professional status, they used to be manager, spa manager, and this that. Anyway, you are a 5.5 years graduate now. Post graduation, people are doing MD and all that. So they should have their professional identity as naturopaths. People used to write medical officer. I suggest you write naturopath. What is that? I think we have some inferiority complex when we say I am a naturopath. Why should we have such a complex? Let us say I am a naturopath. There is a senior naturopath, there is a junior naturopath. We can create designations. The way you see in Ayurveda, people say he is a Vaidya. What is the harm in it? Or in Unani, we say Hakim. What is wrong with it? We must have our identity as naturopath. We must have our identity as a yoga therapist. And whether somebody allow us to use doctor or not, that is immaterial. In if you see my old letterheads, I used to write myself as naturopath, S. N. Pandey naturopath. So people say, no, no, you write nature cure specialist. I say, okay, you put nature cure specialist. Because when you write a specialist, you can charge more money. That was the idea when I work in nursing home. They say, no, no, in your board we will write nature cure specialist. I say, you write whatever you want. But naturopathy should be there. I should be distinct from other doctors and let people know that I am a naturopath. So all these things are required to be discussed in
Yes.
seminars, and
Yes.
some you see circulars are required to be brought out. And we don't have any single professional organization.
Thank you very much, sir, for that very positive note. Right?
Thank you for remembering me.
Yeah.
Actually, I am
Yeah.
very happy that
No,
you people
without
are
you,
coming back.
how will we know all these things, sir? Yeah. You have to share it with us. Yeah.
There are still a few old people surviving. I think you should contact them also. They will tell
Yeah.
you so many things.
Yes.
Okay.
Yeah.
Thank you. Thank you very much.
Yeah. Thank you, sir. Thank you.